Hi there. Pretty much every one of us goes and gets our physical once a year at least. And within that physical, you get your blood test done, and your doctor looks at the test results. And if your test results are within the ranges of the lab that they recommend, then your doctor says, congratulations, you're in great health. I'll see you next year. And you go on, right? Now, have you ever had your blood chemistry analyzed nutritionally? There are so many hidden meanings in your test results that if your doctor or the practitioner, your health coach, if they are trained in functional blood chemistry analysis, they be able to see it and break it down for you. For example, when you get your test results, this is pretty much something what you get. These are my personal ones, so I can show you. These are your test results. And if you're within these ranges, that nothing says out of range, then you're good, right? Well, mine, there is nothing showing out of range. Everything is within range. But as you can see, these penciled in notes, these are my notes that I analyzed my own blood test results. And it showed several numbers indicated I have some kind of inflammation in my system. Now I've made some dietary changes. Within a month or so, I'm going to run my blood test again to see the changes I've made, how it shows up on my blood test results. And hopefully it would be good. This is what I'm talking about. There are so many hidden meanings in your test results that is trained professional can actually see it and break it down for you. Just a simple example. Let's say you do your blood test and your cholesterol comes up high. Depending on your doctors, your age, your body composition, they may recommend you make some dietary changes like lifestyle changes, exercising, or they may say, you know what, you need to take some cholesterol lowering medications like statins. In my practice, I see so many, not too many, but I have few patients that are actually great shape. They exercise, they eat really healthy, but their cholesterol is high. Now, we know there could be a genetic predisposition that they have high cholesterol, but some of them, that's not the reason. When I look at the blood chemistry and I see high cholesterol, the first thing I go look at is thyroid. Is thyroid functioning the way it should be? Because if thyroid is not functioning properly, your body goes through this thing called lipogenesis, which means your body makes fat, which makes your cholesterol numbers high. So if you're making these dietary lifestyle changes, which are very beneficial for your body, to eat more vegetables, to do exercise, to do stress relief, they're all great. But that's not going to bring your cholesterol numbers down if you're not taking care of your thyroid, which is the main reason for your cholesterol numbers going up. Or the other reason could be, let's look at the liver, because the cholesterol is made in your liver. Is your liver functioning the way it should be? This is just one of the examples. There is so many more that functional practitioner can look at your blood test and just look at the hidden meanings of it and just break it down for you. It's very interesting. I would highly encourage you, if you've never experienced it, find a practitioner close to you that you have recommendation or rapport with, and have them run your blood test and analyze it for you. Get lots of information. Now, you may say that you don't have any recent blood test and you really don't want to make an appointment with the doctors or wait until your insurance gives the okay for you to run a blood test. I have a great workaround. I'm going to share my screen with you, and we'll see right here. The link to this website is going to be on your in a video description. So once you go here, there's a 3 easy steps how you can order your own blood test. Here you come down and you see these are all the blood tests available. Generally, I would recommend clients do the general health screening, the top 2, the comprehensive blood count and comprehensive metabolic panel. If you order them together, you get a discounted $39. And then you go and do the cholesterol, basic fasting lipid panel, $30. For $69, you get a complete blood count. We can see a huge, the overall how your health looks. If you want to know what these tests mean, you can come on the right side and look at the test description. And it pretty much tells you here what they mean. The same thing with the cholesterol, what they mean. Now, if you're type of person, you want to know exactly what is tested in each of these tests, then I'll be able to show it to you right here. As soon as I'm able to open it, apparently I'm having issues right here. So then you'll be able to see, okay, what's exactly included in CBC, CMP, and a lipid panel. I didn't mention anything about advanced lipid panel or cardio IQ, they call it. It includes everything that's in lipid panel, but a little bit more extra stuff. And I recommend people that have a family history of heart attacks, cardiovascular disease to get this done, because you get a lot more information than just your cholesterol. Like I had this test done on myself because my father had 2 heart attacks. So I wanted to see what are my risks if there is anything obvious I need to worry about. And mainly I wanted to see this lipoprotein A, or called LP little a. And happy to say that it was very low. And so I don't have to worry about it. This is going to be in the blog post. You can definitely see it. Now, once you actually know, you choose your test results, then you are going to go back to here. You chose your tests, what you want to run, okay? Then you put your zip code, and they will show you the closest labs that are near you, whatever is convenient for you. They use Quest Diagnostics, which is pretty much everywhere in all major hospitals. Within 48 hours, you get your test results back. They are not shared with me. You're the only person sees them. You can then send it to your doctors, or if you decide that you want me to do your blood chemistry analysis, then after we set up an appointment, you can email it to me, okay? Now, again, it's very simple. If you go to my blog post, I'm offering complimentary 5 people that will make comment in my blog post. They will be chosen to get their blood chemistry analyzed nutritionally, absolutely free. That is just my gift. I would like to show you how much information you can see in your blood test. It's amazing. You get so much information. So if you have any questions, please feel free to put it in the comments, and I'll be happy to answer. And hopefully you'll be one of the people that will get their blood test analyzed. You be well.